My name is Oscar. I'm 32 years old. I'm from Brazil and Paraguay, but my family is Chinese, and I'm currently living in New York. I have essential thrombocythemia. I was diagnosed in 2022 in December, but my platelets were getting higher in 2020 when I was having a physical checkup, and I didn't have any symptom until July 2022 when I had headache and stuff, and I got diagnosed in December 2022 from essential thrombocythemia with the biopsy. Yeah. They made me the biopsy. I don't know how to say it in Spanish. I got diagnosed with CALR mutation, CALR1, from essential thrombocythemia. At first, when my platelets were getting higher, my doctor, my primary care physician, that's the doctor that checks me up every year for the physical checkup, he recommended me an hematologist that was in the area where I lived, and he didn't give me any diagnosis nor any test. He just prescribed me aspirin and said that I had to take a lot of water, that I had to take aspirin, that I had to go back every 3 months or stuff like that. And until July from 2022, when I started having headache from these symptoms, I went back to the hematologist and he prescribed me hydroxyurea. That was the medication for essential thrombocythemia in that time. It didn't work, but he didn't give me any explanation or something like that. So I went to another one that was Jean Mascarena here in New York. And I started seeing a hematologist in Wire, but he told me that John Mascarena was the best of MPN. So I went to John Mascarena and he made me the biopsy. And in December I was diagnosed with essential thrombocythemia. When I started getting higher, it was 300, 400. That was little by little. But when I started feeling the symptoms, it was like 900, a million. I don't really remember, but recently when I went to the doctor, they told me that I had support groups from chapel, kind of like social workers and stuff like that to help me. But I was already seeing a social worker outside from the hospital, so I didn't need one there. So John Mascarenas was the doctor that was seeing me, but the research team from the clinical trial was another team. That was the Dr. Catherine Caldiza, that they gave me the forms to sign the signature, so I could understand how the clinical trial was, how the symptoms are, or the side effects, and some explanations. So I had to sign and start the clinical trial after that. When I went back from China, they told me that there's different treatments for my ET, and one of them was the clinical trial from Metrotaxi. And I said that I wanted to join and try because I wasn't feeling well, and I started after that. They told me that the clinical trial is 6 months or 1 year long, and if it works well on me and has good effects, I would take it for my whole life. I started with hydroxyurea with the first hematologist, but it wasn't working, so I went to Yaron Mascarena, and he changed the doses from hydroxyurea, but it wasn't working very well treating my symptoms. So my dad, that's Chinese, he was searching how to treat the ET in Chinese. So he found treatments from Chinese medicine in China. So he told me that I should try, and I went to China for a year to try the medicine from China plus the Western medicine. So I went to China in September from 2023 until September 2024. I stayed there. So when I was there, I was taking 2 classes from herbal medicine, Chinese medicine, 2 per day. And I started using the injection, PET interferon alpha 2A, that I got prescribed when I was at the hospital there. The equivalent here in the Western world, I think it's Pegasus or Remy, I don't know which one. And when I wasn't feeling very well, because I think my worst symptoms were when I was in China. It was when I was there. So I went back here and I started visiting Jean Mascarene again, and he told me that I had to start again because he didn't know how the medicine would interact with each other. So when I started in July 2022, I had kind of headaches and dizziness. I don't know how to say it in Spanish, but I felt very bad in my head. And when the April from 2003 arrived, but some months later, that when I started with the symptoms, I started feeling fatigue, and I wasn't able to play basketball. That's my sport, my first way of training. And when I went to China to see if there were any improvements, everything got worse. All my symptoms got worse when I started taking the Chinese Pegasus, and I had to be laying in bed for some months because I wasn't able to walk properly because of the fatigue, the pain, and the suffering, and all of the stuff. It started getting better in August 2024, a month earlier coming here to New York again. And here everything went much better until, well, it improved, but when I started the clinical trial for methotrexate, it got even better. So I don't feel any symptom right now, and I'm able to do exercise. The Chinese medicine is not something that works immediately. It's something that it's a habit that you have to have. So you just have to take, when you start, you're not going to feel the effect. You have to be patient, and some months later it's going to work. But I had to go back after a year, so I don't know if it's going to work more or not. It's a little bit better, but not 100%. I can't run as I did normally. I have to walk a little bit because I still feel the fatigue. So I just walk and I throw the ball. I take vitamin B12 or B complex, These three. And what else? And folic acid, because I have to take it with, I got prescribed it on the clinical trial. Those are my supplements, and they gave me that. But I told my doctor that I was taking that, and they said it's nice. I'm currently single and I live with my parents here in New York. And my parents were the first people that knew my condition, my diagnosis. And my parents were a little bit more anxious and worried. And myself as well, because I was suffering a lot. But I think that every time I go to the doctor and the numbers are better, I think they feel more relaxed after that. The most of the time since 2022, I couldn't. Well, at first I was able to work, but when I went to China, I quit my job here, and when I came back, I didn't have the well-being to be able to work again for a while. I feel better now, and I will work, I think, soon, but not right now. And I can go out with my friends sometimes, but I can't stand for a long time because I feel very tired, the fatigue. And when I'm tired, it's a kind of tiredness that it's not the tiredness after working out, is pain on the chest. I told to some of them that talk to me more frequently, but not all of them, all my group of people that I know, because I'm organizing a group of basketball from the community, and we have 50, 70 people there, and I didn't tell it to everybody. I think it's going to help us a lot because there are some struggles that young people experience, and I think that some people that we experience that other people don't know, maybe other people who don't have MPN or maybe are not the same age as us. So I think it's going to help us a lot in the aspect of mental health and things like that, the support. The worst thing that happened to me was the suffering that it brought me and my family because of the symptoms and the diagnosis and stuff like that. But the best thing that had happened to me, I think it's that when I found out that MPN that I had was kind of like a weird blood cancer that my friend searched on Google. I thought it was a terminal cancer, that I didn't have a treatment for that. So when I thought about that, I asked myself 4 questions to myself. What was my existence about? Did I make my parents better? Did I make them better? Did I make my friends happier? Did I make my community better? And did I make the world a better place with the time I have in this world? And I think throughout the years, these questions were my purpose of existence right now. I just want to make the world a better place with the time I have in this world. And I think it's the best thing that had to happen to me because of MPN. The first advice I would say, let's have a lot of hope on heart, and things can be very bad at first, but they always improve and get better.